Gentlemen, imagine this. You wake up tomorrow morning, swing your feet out of bed, and for a second something feels off. The floor is there, but your feet do not feel fully connected to it. Maybe it is tingling. Maybe it is burning. Maybe it is that strange numb, padded feeling like your socks are bunched up under your toes when they are not. For some men it feels like pins and needles. For others it feels like walking on sand, ice or sharp gravel. First, it is easy to ignore. You tell yourself it is age, or poor sleep, or the way you were sitting yesterday. But then it keeps happening. Maybe at night. Maybe after a meal. Maybe when you stand too long. And now a simple walk does not feel as steady as it used to. Now here is the key. There is no magic switch for this. There is no one pill, one stretch, or one overnight fix that turns numb feet back to normal by tomorrow morning. But there are proven practical steps that may help support nerve function, improve circulation, build stability, and reduce your risk of making the problem worse. And that matters. Because when your feet stop giving your brain clear information, your balance changes. Your walking changes. Your confidence changes. And if you keep ignoring it, small problems can quietly become bigger ones. So today I want to give you a calm, simple plan. Not hype, not fear. Just a clear routine you can do safely at home to support your feet, your legs, and your overall nerve health. But before the routine, you need to understand why this happens in the first place. Because once you understand the why, the plan makes a lot more sense. Your nerves are like electrical cables. They run from your brain and spinal cord down through your legs and into your feet. Those cables carry messages in both directions. One set tells your muscles what to do. Another set brings information back to your brain about pressure, temperature, pain, and position. In simple terms, your feet are constantly reporting back to your brain. They say, I am on flat ground. I am stepping on something soft. I am rolling too far inward. I am getting too much pressure under the toes. I need help balancing. When the nerves are irritated, compressed, inflamed, or damaged, those messages become weak, delayed, or distorted. And that is when you feel numbness, tingling, burning, coldness, unusual sensitivity, or a sense that your feet are not quite there. There are many possible reasons for this, but most of them fall into three big mechanisms. Mechanism number 1, blood flow. Think of circulation like plumbing. Your feet are far away from the main pump, which is your heart. If blood flow is poor, nerves do not get the oxygen and nutrients they need. Over time, that can affect how well they function. Conditions like diabetes, high blood pressure, smoking, inactivity, and vascular disease can all play a role here. Mechanism number 2, nerve irritation or damage. This can happen for many reasons. Long-term high blood sugar is a major one. Vitamin deficiencies, especially low B12, can also matter. Alcohol excess, certain medications, back problems, and pressure on nerves at the spine or lower limb may also contribute. Sometimes the problem is local. Sometimes it is part of a bigger metabolic picture. Mechanism number 3, loss of feedback and control. This is where most men get it wrong. They think numb feet are only about sensation. But nerves also help with coordination, balance, and movement quality. So when nerve feedback drops, your body becomes less precise. You may grip the floor with your toes without realizing it. You may shift weight poorly. You may walk more stiffly. You may become less active because movement feels uncertain. That creates a vicious cycle. Less movement, less circulation, less strength, less confidence. So the goal is not just to feel more. The goal is to support the whole system. Circulation, mobility, balance, and muscle activation. That is where your routine comes in. Let's make this simple. I call this the 4-step routine. You can do it in about 15 minutes. You only need a chair, a little floor space, and steady effort. No gym. No complicated equipment. Just consistency. Step 1, wake up circulation. Start with a seated march. Sit in a sturdy chair. Sit tall, not slumped into the backrest. Place both feet on the floor. Then begin lifting one knee, then the other like you are marching in place. Add your arms if it feels natural. Opposite arm, opposite leg. Keep the movement smooth. Your goal here is not speed. It is rhythm. You want your breathing to pick up slightly, but you should still be able to speak in full sentences. Start with 3 to 5 minutes. If that feels easy after a few days, build towards 7 to 10 minutes. Why does this matter? Because nerves like blood flow, muscles like blood flow, joints like motion. A gentle seated march warms the legs, improves circulation, and tells your nervous system that movement is beginning. It is the safest possible entry point for many men, especially if balance is not perfect yet. If seated marching feels too easy later on, you can transition to walking indoors, a stationary bike, or a short outdoor walk. But for many men, seated marching is the right starting point. Step 2. Retrain balance. Now here is the part that often gets overlooked. If your feet feel numb, your brain gets less accurate information from the ground. That means your visual system starts doing too much of the work. You rely on your eyes more and your feet less. Over time, that can make your balance worse, not better. So we gently rebuild that connection. Exercise 1 in this step is the supported single leg stand. Stand behind a chair and hold the back of it with both hands. Shift your weight onto one foot. Lift the other foot just slightly off the floor. You do not need to bring the knee high. Even 1 inch is enough. Hold for 5 to 15 seconds, then switch sides. Do 3 rounds on each side. If this feels easy after several days, reduce your hand support. First 2 hands, then 1 hand, then just fingertips. But only if you feel safe and steady. What this exercise teaches your body is simple. Find the foot, load the foot, trust the foot. Exercise 2 is heel-to-toe rocking. Stand with both hands lightly on a chair or countertop. Slowly rock back toward your heels so your toes lift slightly. Then roll forward onto the balls of your feet, so your heels lift slightly. Move slowly. Pause for 1 second at each end. Do 10 to 15 repetitions. This small movement does a lot. It wakes up the muscles around the ankle, trains weight transfer, stimulates pressure receptors in the soles of the feet, and gives your brain cleaner information about where your body is in space. And that is a major theme today. Better input creates better movement. Step 3. Wake up the feet themselves. This is where many men finally realize their feet have become passive. The little muscles get lazy. The toes stiffen. The arches stop doing their job. And the more that happens, the less support your body gets from the ground up. Exercise 1 here is the calf raise. Stand at a chair. Hold it lightly. Rise up onto your toes slowly. Pause at the top for a count of 1 or 2. Then lower back down under control. Do not bounce. Start with 8 to 12 repetitions for 1 or 2 sets. This is not just a calf exercise. It is a circulation exercise. Your calf muscles act like a pump. When they contract, they help move blood back up the leg. That supports circulation and may help reduce that heavy, stagnant feeling many men get in the lower legs and feet. Exercise 2 is towel scrunches. Sit in a chair. Put a small towel flat on the floor. Place your bare foot on the edge of it. Then use your toes to pull the towel toward you. Relax. Repeat. Do 8 to 10 pulls with each foot. At first, this may feel awkward. Good. That means you are asking the foot to do something it has not been doing well. You are waking up small muscles, improving toe control, and challenging the connection between your brain and your foot in a safe, low-load way. Exercise 3 is ankle circles and the alphabet. Sit down. Lift one foot slightly off the floor. Make slow circles with the ankle, 10 in each direction. Then, if you want a little more challenge, imagine writing the alphabet in the air with your big toe. This is not about artistic skill. It is about range of motion, motor control, and gentle nerve-friendly movement. When you combine calf raises, towel work, and ankle circles, you support the foot from several angles: muscle activation, circulation, and movement quality. Step 4. Support recovery outside the routine. This is where men often underestimate the basics. They want the perfect exercise but ignore the daily habits that make exercise work better. So let's clean that up. First, hydration. Nerves, muscles, and blood volume all work better when you are not chronically dehydrated. You do not need to obsess over numbers, but if your day is mostly coffee, soft drinks, or long gaps without water, fix that first. Second, walking. Even 10 to 20 minutes of easy walking on most days can help support blood flow, joint motion, and metabolic health. If outdoor walking feels unsafe, walk indoors. If that is too much, return to seated marching more often. Third, food quality. This is not about perfection. It is about removing what works against you and increasing what supports recovery. More protein, more vegetables, more fiber, better fats, fewer ultra-processed foods, less excess sugar. Better blood sugar control helps the entire system, especially if numbness is connected to insulin resistance or diabetes. Fourth, sleep. Sleep is repair mode. That is when your body does maintenance. Poor sleep raises stress hormones, affects blood sugar, worsens inflammation, and makes pain feel louder. If you snore heavily, wake up exhausted, or suspect sleep apnea, that is worth discussing with a doctor. It is more important than many men realize. Fifth, stress. Stress does not directly cause every case of numb feet, but it can make symptoms feel worse and can push blood pressure, sleep, blood sugar, and muscle tension in the wrong direction. Even 5 minutes of slow breathing, a short walk, or simply reducing late-night screen time can help. Now, before we go further, let's talk about the mistakes, because this is where progress often gets delayed. Mistake number 1. Doing too much too soon. Men love to test themselves, but nerves and irritated tissues do not respond well to being shocked. If a routine says 10 repetitions and you jump to 30 because you are motivated, you may flare things up. Start at half. Build gradually. Mistake number 2. Training through warning signs. Mild muscle fatigue is one thing. Sharp pain, increasing burning, dizziness, chest pressure, major balance loss, or new weakness is another. If an exercise clearly makes symptoms worse, stop and reassess. Mistake number 3. Wearing bad footwear. If your shoes are tight, unstable, overly worn, or completely unsupportive, your foot mechanics will suffer. Choose shoes with enough room in the toe box, good grip, and stable support. And if you have reduced feeling, check your feet daily for blisters, cuts, redness, or pressure areas. Mistake number 4. Ignoring the cause. Exercises help support function, but they do not replace medical evaluation. If blood sugar is high, if B12 is low, if cholesterol and blood pressure are poorly controlled, or if there is a spinal issue involved, you need to address that too. Mistake number 5. Being inconsistent. This is the big one. Men do 1 strong day, then skip 4. That does not work well for nerves. Consistency beats intensity almost every time. Now let's cover safety and red flags. Because some symptoms should not be managed with home exercises alone. You should speak to a doctor promptly if you have rapidly worsening numbness, new weakness, foot drop, severe pain, new swelling in one leg, skin color changes, non-healing wounds, fever, loss of bowel or bladder control, or symptoms that started suddenly after a back injury or illness. You should also get medical advice if you have diabetes and your symptoms are changing, if you have known circulation problems, if you are on medications that may affect nerves, or if numbness is affecting your balance enough that you feel unsafe walking. And please do not ignore nighttime burning, repeated tripping, or wounds you cannot feel. Those are important signals. Now here is your challenge. A simple 14-day consistency plan. Days 1 to 3. Do seated marching for 3 to 5 minutes. Single leg stand with both hands on the chair, 3 rounds each side. Heel to toe rocks 10 reps. Calf raises 8 reps. Towel scrunches 8 per foot. Ankle circles 10 each direction. Days 4 to 7. Increase seated marching to 5 to 7 minutes. Bring single leg stands to 10 to 15 seconds if safe. Heel to toe rocks to 12 reps. Calf raises to 10 to 12 reps. Keep towel scrunches and ankle circles steady. Add 1 10-minute easy walk on most days if comfortable. Days 8 to 10. Try using less hand support during balance work if safe. Build seated marching toward 8 to 10 minutes. Focus on slower, cleaner movements rather than more repetitions. Check your feet after each session. Days 11 to 14. Keep the full routine at around 15 minutes. Aim for smooth marching, controlled balance work, and better toe control. Notice what changes. Steadiness, confidence, warmth in the feet, ease of walking, or awareness of foot position. Do not expect perfection in 2 weeks. That is not the goal. The goal is to create momentum. The goal is to tell your body every day, we are moving again. We are supporting circulation. We are improving control. We are paying attention. And that matters more than most men think. Because helplessness is not a treatment plan. Avoidance is not a treatment plan. Guessing is not a treatment plan. But a calm, structured routine combined with medical common sense? That is a real starting point. So if your feet have been going numb, tingling, or burning, do not panic. But do not ignore it either. Start simple. Move daily. Support the system. Watch for red flags. And if symptoms are progressing, get evaluated properly. Control comes back in layers. First awareness, then routine, then consistency, then progress. Stay patient. Stay steady. And if this gave you a clearer plan, subscribe for more practical, doctor-led health guidance you can actually use.